Amrita. I'm running a clinic by name of Amrita Dental Clinic, and I'm a co-founder of Amrita Dental Academy, Bangalore. As I mentioned in my previous videos, I'm running a dental academy by the name of Amrita Dental Academy, where we are grooming the budding dentist. Here I'll be utilizing my 15 years of experience to train the dentists, those who really want to flourish their career in dentistry. Today we have Dr. Akhil with me in my clinic. Hi Dr. Akhil.
Hi.
Can you tell more about yourself?
Hi, myself Dr. Akhil. I passed out from KT Dental College in the year 2020.
2020?
Yeah.
Okay. So if I'll ask you, Dr. Akhil, what is your vision? Like how you're looking forward for your career in dentistry?
For me, it's like ending up opening a clinic.
Mm-hmm. Finally,
yeah.
It is a dream of any, whenever we are selecting the profession, right?
Yes, yes.
So at the final end, either we select for the post-graduation. After post-graduation also we love to have our own practice, correct?
Yes, yes.
So let's say the topic what we are discussing today, I really want to tell all my doctors and the practitioner and the juniors, this topic, the case history is really important and why it is important. The case history is divided, the patient history has been divided into 4 to 5 things. Let's say personal history, the professional history, the social history, the medical history and the past dental history. So coming to the personal information or the personal history, can you just tell me what is there in your head if the patient comes to you? What all personal history you would start?
Personal history, I think it let us know more about the patient.
Mm-hmm. Yeah, they feel more confident, right?
Yeah.
Let's say we start with the name. We should always know the name of the patient, right? Because this will help to elicit the history properly and it will also be psychologically benefit to the patient. In case of pediatric patient, if you address the patient with their name or their pet name, they will be more confident and they will feel free to talk to you. They are not scared.
Yes.
Because anyways we know the dentist, right? And the dentistry, we are more scared, correct?
Yeah.
Everyone when it comes is like, oh, we have to go to the dentist. Next come after the name, we have to find out the age of the patient. What is the importance of the age if I'll ask you, Dr. Akhil? What is there?
Most of the patients comes with the age-related disease.
Yeah, there are so many diseases have been categorized as per the age.
Yeah.
Let's say is the early, if the patient is young, right? So we can find out the rampant caries are more common, then bottle feeding is there, right?
Yes.
Then it comes to middle age and all, we can see attrition is there, right? Facets are there, and when is coming to the geriatric patient or 60-year plus, they'll come with the edentulous arches and all. So definitely the age is a factor which we have to know. Then it comes to the address, right? Why we should know the address? It's very common, right? Because we have the form, we should all have a form in the clinics which will say all these details, right? There is a categorization we'll be showing, so you can check it out what we are following in the clinic in the description box. So you can just have a look. So fine. So why address? It's very common. You have to find out in the form we can add on. So patient will have to give the address. Why address if I'll ask you?
Because there are still places where, for example, if we say fluorosis,
yes.
it's a place-related disease.
It's place relevant to the area or that place. So there are so many diseases that we can easily find it out. Let's say it's like a geographical prevalence of a dental or oral disease. A few diseases have got geographical distribution. Dental caries and mottled enamel are dependent on the fluoride content of the domestic water, as we say. In India, cancer of the lip is very rare, and cancer of tongue and buccal mucosa constitute the bulk of oral cancers. In Mumbai, in cancer patient, common site affected in the tongue, and in Chennai, it is in buccal mucosa. Strange, right?
Yes.
But if you know all these things, it's very helpful for us to diagnose. Dental caries is more common in modern industrialized area, while periodontal diseases are more common in rural areas. Habits are also vary according to residence. Like say tobacco is common in Tamil Nadu, gutka in Bihar, hukli in Bhavanagar district of Gujarat. So these are the common habits the contents what we can see in different places. Then comes to geographical prevalence of medical disease. So next is sex. We have to mention the sex of the patient. Anyways, we will mention the patient, right, male or the female. What is the evidence of what is the significance of it?
So in female and male patients, if we take in female patients, it depends on the pregnancy and lactation period. and
Yes.
cyst.
Cyst is there.
Yeah.
Extracellular cyst is there. So basically, whenever the patient is coming, as we all know, during the 9 months of the pregnancy, we have to be very particular, right?
Yes.
So when we are taking the history, we have to find out, because the dental procedure we can do it safely, right? But the first and the last trimesters are not safe. So we have to focus, if the patient is coming for certain like pain related problems, we have to take it on the second or the middle trimester. Remaining scaling and general filling we can do safely. Other procedures than that, root canal, or let's say we have to take a call for the extraction, then we should consult a gynec. Always take a consult form. We should talk to the gynecologist and then we can help the patient. For lactation, we should always ask the patient like they have the kids, what is the age of their kids, because it depends on like lactation for how many hours, or like it's like regularly full day or night time they are feeding the babies, because certain drugs they will cross the blood brain barrier. It can affect the kids. So for that reason we have to find it out. If they are feeding the babies, then we have to give certain instruction that before 2 hours or 3 hours of feeding, like they have to take the medicine. So nothing, there's no effect on the kids. So it's like occupation. We have to ask the patient occupation. What do you think about it?
Occupation, I guess it's based on the financial status. For example, let's say a patient comes for the implant. So not everyone can afford the implant treatment.
Yes.
So for that we'll have to discuss first with the patient. We should know the occupation of the patient so that we can provide them with the correct treatment.
The treatment,
Yeah.
yes. The line of the treatment varies like on the final status of the patient also, which we can offer. Like if we give unnecessarily implant or other option, might be they will not opt for it. So we can give the bridge option and all.
Yes.
Then next comes the social history.
Social history.
Social history counts what all things?
Ma'am, it includes the lifestyle of the patient.
Yes.
The lifestyle, what they eat,
What
they
kind of
have,
food?
yeah,
What kind of food their intake of food is there? And let's say how many times they are going outside for like say drinking and all, smoking and all, because all these things, as we all know, right, smoking will affect their mucosa, correct?
Yes.
If they are a chain smoker and all, that mucosa will be tough. It will affect the gums, the gingiva, right? There will be pigmentation with them. So we have to sort it out, and we can help out the patient to kick the habit if they are ready, right?
Yes.
So we have to guide. We have to just explain the patient what are the side effects of it and how we can treat it. Let's say scaling, certain procedures are there. We can just tell once we are doing the cleaning and all, this all things will be there.